Hello and welcome to Healthcare Voices, where we bring you authentic voices behind healthcare innovation and impact. I'm your host, Katherine Cummings, former clinician turned healthcare technology advocate, and today I have the privilege of speaking with Dr. Todd Otten, a family medicine physician, former naval flight surgeon, and co-author. Dr. Otten is an advocate for disrupting the status quo in our current medical system, and he's the co-founder of movement Our Quadruple Aim, which I am so excited to talk to him about today in the podcast. Thank you so much for joining us, Dr. Otten, and welcome.
Thanks for having me. It's a pleasure to be here.
So I'd love to start the podcast by learning a little bit more about your journey to becoming a physician. Can you share with our audience what led you to the field of medicine and really what inspires you to continue your work in medicine?
Yeah. So, what inspired me to go into medicine? Probably a combination of things, to be honest with you. I was always interested in science and I did well in school. And so I was looking for challenging things as a kid and debated lawyer and stockbroker and physician. And then I had a job working at Parks and Recreation. And it was really that human connection that I think steered me towards medicine. And I realized early on that I wanted to become a physician. I wanted to make a difference in the world. I wanted to help other people, and that seemed like a natural fit. So I was probably 16, I think, when I made that decision. And then it was head down, straightforward into college, head down, straight into medical school, and then I was in the Navy. And I love seeing patients. Don't get me wrong. It is an absolute joy to take care of other human beings. I think the reality is that we have so many issues in healthcare right now that detract from that relationship and have eroded the trust between the doctor and the patient. And that's really what drives me with a lot of my work now, with advocacy and the writing and all those other things. So, yeah, it's been a fun journey. There's definitely been some bumps in the road, but I wouldn't trade any of it.
Before I dive into some of my other questions, I wanted to say I read your book, Ripple of Change. I have it right here at my desk with me. It resonated very deeply with me, and I'm actually going to put a link to your book in the podcast, the summary, for anyone who's interested in reading it as well. I'd love for you to share with our audience a little bit about your book. What inspired you to co-write Ripple of Change with a patient nonetheless, and what inspired you to just kind of write the book in general?
Yeah, there's a lot that went into it, and writing a book is no small feat, for sure. I had always wanted to write a book. I think it was kind of quote unquote on my bucket list, if you will. I didn't really know what the topic was going to be. After I went through burnout in 2019, that was really painful. That was a hard couple of years, really, for not just me, but my patients and my family and those that were close to me, and how it negatively affected all those individuals. And so initially the process started probably more as catharsis. I wrote the poem Medicine is a World of Gray, just kind of getting it out there, how I was really feeling about some of the struggles as a primary care physician. That led to writing a chapter called Anatomy of Burnout, which is really a kind of a deep dive into my journey through that time in my life and the pain that was associated with it and all the factors that contributed to it. And so it started to get some momentum. And initially my thought was, okay, maybe I can write a book to bridge the gap between physicians or clinicians and administration, because when that gap exists, it creates so many problems. When those groups are working together, it can be magical, and care delivery can be amazing, to be honest with you. Unfortunately, that's not what's going on in many instances. But when Joshua, my co-author, got involved, it took on a very different trajectory, the book. It became not this small audience that we were targeting, but really kind of everybody, because we started to feel like, hey, you know what? If everybody does a little bit of something positive within the healthcare space, not just making noise, but working towards positive change, it can become very powerful. And when Joshua got involved, it wasn't just the doctor talking about the problems. It became both sides of the coin, and it became this magical journey of back and forth between he and I debating things and talking about things. And through that, we both really healed with our individual issues. Mine was related to recovery from burnout. And Joshua's was related, frankly, to the mess that I caused for him with the prescription that I wrote for him. And through that process, we really hope to inspire and empower a lot of people to improve the current landscape.
Something that I really liked about the book was that the stories are really interwoven. It's not just, the sections of the book that are yours and his. It kind of goes back and forth throughout the story, and it really builds on each other. And that really starts in that first chapter where you guys open up with a really poignant story about physician suicide. And as I was reading, I was Googling, as one does when they're looking at anything that has statistics, and I found that about 40% of physicians chose to keep suicidal thoughts a secret from anyone. And when you and I were talking before this podcast, you shared with me that during the pandemic, there was really an alarming rate of physicians not only experiencing that severe burnout that you mentioned, but also committing suicide. And my question is, why is provider wellness such an important issue to shed light on?
Oh yeah. So wellness is critical because when physicians aren't well, or clinicians or nurses, or really anybody that's delivering care, you're not getting their best, right? And it totally impacts the other components: cost, quality, the patient experience. I think back to some of Joshua's comments in the book. Like, he made the comment, I think something to the effect of, no wonder why that visit sucked. You were barely keeping up for yourself at that point. Imagine you have a physician in front of you who's depressed and thinking about suicide. Where is their mind at? It is not 100% focused on the human being that's in front of them. And so there is study after study. There's tons of data that show that when physicians are doing well, the care that they deliver is better. Patients have a better experience. Costs tend to be contained. And so, frankly, the majority of stakeholders win in that instance. And that speaks to why I'm such a big advocate for, we call it Our Quadruple Aim, which is essentially the same as the quintuple aim. We went from the triple aim to the quadruple aim, and now the quintuple aim. And in short, it's not that difficult. Our quadruple aim is patient experience, quality care, lower costs, and then I use the word provider wellness, which provider has a whole can of worms attached to that. But yeah, and so, but then we put the word "our" in front of it because we feel like we needed that equity piece, right? And so, by putting "our," it's not mine, it's not Joshua's, it's everybody's quadruple aim. And take it, run with it, use that as a lens when you're making decisions in the healthcare space, to account for the majority of individuals. And when you do that, magic can happen. I've seen it work. It totally can be done. But it takes some effort for sure.
I'm going to circle back onto the poem that you mentioned earlier, the Medicine is a World of Gray. And the poem is both in your book and it's on the website, ourquadrupleaim.com. And when I read the poem, I think it really resonated with me because it really describes the kind of challenges and dichotomies that you have faced over the last 20 years while practicing medicine. You're lamenting the clerical burdens while also finding joy and patient interactions and making a difference in people's lives. And I think people really go into medicine with the idea that, they want to make a difference. They want to have impact in other people's lives and on the system. How do you think that healthcare leaders can reconcile these contrasting experiences to create a more supportive and balanced environment, not only for physicians, but really anyone providing care within the medical system?
Well, unfortunately, our system is geared towards profit in many instances, and that creates a lot of problems. Just a lot of problems. We need to move that needle back to people over profit. And, the reality is when you do that, you tend to do quite well. Like when you're treating people well, they have better outcomes. You don't spend as much money. I've seen it work, but the driver all too often is to the almighty dollar. And a perfect example is prior authorizations, right? I don't know of any of my colleagues that are fans of prior authorizations. It creates a mountain of paperwork. It creates barriers to care. It creates delays. And without a doubt, it has killed people. I have no doubt about that. And who benefits from prior authorizations the most? The payers, typically, because it's limiting expenditures. And so when you've got these competing forces of you wanting to do the best for the patient, and then on the other side, we're restricting costs and care and creating delays that hurt people, frankly, that creates the entity called moral injury, which one of my colleagues, Wendy Dean and Simon Talbot, wrote in a landmark article, I think it was about 2018, describing this. And so as a physician, you're wanting to do this, but you're limited by the other side of the coin. And you can only take those little cuts so many times before it really starts to wear on, frankly, your soul. And it crushes.
Death by 1,000 cuts, right?
Yeah, you totally.
Yeah.
I was making that a leap, and
Yeah, absolutely.
Kudos to you for picking up on that subtle nuance there. But it's very difficult, and we're at the point where this is causing people to walk away, large numbers. So we're at kind of a critical time in medicine where we need to reverse course on a lot of these issues. And that's really what I was trying to describe in the poem, was like medicine can be amazing, not only for the patients, but for the clinicians and everybody providing care. But when we got all these confounding factors, oh boy, it can also be very dark. And I wrote that poem, kind of coming out of a very dark place in my life. And fortunately, it's been only up from there to a large degree. But yeah, it was really trying to contrast the two, the good and the bad, the light and the dark.
I think, though, it resonates deeply with a lot of people who just feel the burden of the medical system, the dysfunction of the medical system, and trying to balance that with the good things and remember why they went into medicine to begin with, right?
Yeah.
And I'm sure we could talk for several hours about the dysfunction in our health system and how the profits are often the prioritized piece, right? Versus the people in the system. And there are so many challenges, not only on the technology side, but on the care side as well. You kind of briefly mentioned earlier what our quadruple aim, at least what the 4 pillars are, the
Sure.
4 principles are. I'd love for you to dive a little bit deeper into what those pillars are so that we can have kind of a better overview and a little bit of a deep dive so our listeners can understand what those 4 pillars mean and how they can improve the healthcare system.
For sure. So I'll go back, maybe give a little bit of historical context. The Triple Aim came out 2006, I believe, by the IHI, Institute for Healthcare Improvement. And it was really around population health. And frankly, in its premise, I think it's brilliant. I tend to simplify it to patient experience, quality care, and lower costs, but under that umbrella of population health, right? Who doesn't want those things, right? Like, I want a good patient experience that, deliver quality care at a reasonable or low cost, for sure. The issue that resulted to a certain extent from that is it increased clerical burdens even more on clinicians, which definitely negatively impacted wellness. So in 2014, Dr. Sinsky and Dr. Bodenheimer from the AMA, American Medical Association, suggested in a landmark article that wellness piece be included. And when I heard about the quadruple aim, I was like, oh yeah, I get it. Like, this makes total sense. And I was like, immediate adopter of that. I was probably an army of one for 6 to 12 months in my institution. I wouldn't shut up about the quadruple aim, and the wellness piece. But as we got traction in that institution, it was really amazing to see. We didn't lose any clinicians. Like, the physician retention rate, I don't think we lost anybody in that period. We had 9 or 10 family physicians. We were busting at the seams with patient volumes because of the wellness piece. And so back to the question, with our quadruple aim, we took, like I said, a subtle play on it, if you will, to really think about being inclusive with the language. And that's where we swapped out the for our. And again, it's not mine. It's not Joshua's. It's everybody's. We want people to think about it. And it's only 8 words. We tried to make it very simple, very memorable, very action oriented. Again, patient experience, quality care, lower costs. I'll say it, provider wellness, but feel free to substitute it with physician, clinician, healthcare worker, frontline healthcare worker, healthcare professional, whatever works in your institution, right? We don't want this to be polarizing. We want people to take this as a positive framework or a positive lens that when problems come up, you can take these 4 quadrants and say, okay, we've got problem X here. If we only focus on the cost, how is it going to affect those other 3 pieces of the pie, right? And that's very important because you might make a decision related to cost and create 10 negative financial decisions down the road. As an example, my prior employer made a decision to move my clinic from the office utopia, as I call it in the book, back to the town where I got burned out. And the primary driver behind that decision was to save money on rent. Okay, sure, that is going to be a good savings in this one little decision but it completely ignored the other 3 components of our quadruple aim. And by tipping over that domino, it led to the second domino falling, which was me resigning the next morning. Physicians don't resign the next morning willy-nilly. There was a lot went into that decision. But think about all the negative ramifications of that one decision to save money on rent. Me leaving cost the institution probably millions of dollars the following year from revenue, lost referrals, ancillary testing, so on and so forth. And not only that, think about the staff. There were 15 of us in that office when that decision was made. 4 months later, there were 6 that stayed with the system. The system lost 2 nurse practitioners, 1 physician, and 6 other staff as a result of the decision to save money on rent. And so, and I don't want to just focus on the negative here, because really the idea is that if you had taken our quadruple aim and used it as the lens for that decision, I think a very different decision might have been made. Or maybe they would have just come talk to me and told me they were considering doing this. And I would have said, I don't think that's a good idea. Maybe we should talk about it a little bit instead of just telling me you're going to up and move the clinic that I helped build. But I digress. Hopefully that gives some insight as to how it can be utilized. Our quadruple aim can be utilized as a tool.
Definitely. And in the book, you kind of talk about, systematic reforms that can assist with the dysfunction in healthcare as well. I'd love for you to kind of speak to how stakeholders at various levels, being anyone from patients to providers to policymakers, how can they contribute to those changes that will address the dysfunction in healthcare?
Well, I think there's a lot of ways people can contribute, and I think there's a couple points I'd like to make here. I often talk about learned helplessness, and I hear about it daily. Like, well, I'm just one person. What can I do? Well, if everybody has that attitude, which is unfortunately all very pervasive in our current landscape, well, then nothing will happen. But if 330 some odd million people do something in a positive way, then we will start to see positive change. For example, say you're a patient who is wanting to contribute to positive change within healthcare because you're frustrated with I'll pick one of 10,000 reasons why you might be frustrated. I don't need to give examples, but maybe skip your morning cup of coffee and donate to an organization who's working towards positive change. Obviously, I work with a few organizations, and I'll highlight one with Medicine Forward, but donate $5. That organization is volunteer-based by positive change agents who are really working towards restoring the trust and the bond with the physician-patient relationship and everything that's encompassed in that. So that's just a small example, right? Maybe it's how you vote. Maybe you look to see what candidates are wanting to really work towards positive disruption within the healthcare space. Maybe it's writing a letter to a senator. Maybe it's listening to a podcast such as this, or maybe you listen to my packet. Maybe you buy the copy of the book and get some ideas in there. It can be as simple as writing a thank you note to your doctor, so that when they're in that deep, dark place, they have a light of positivity, so we can stop this ridiculous amount of physician suicide that's going on in this country. It's deplorable what's happening, and people need to be aware of it. These are all simple, actionable items that everyone can do, and obviously I'm biased. I'm one of the co-authors, but we feel like we offered rather just tons of simple, actionable things that people can do. And so it doesn't have to be that you're the president of a big organization to make change. It can be those little butterfly ripple effects that can lead to really, hopefully, waves of positivity.
I think that really is a good lead into my next question. Before the podcast, you shared your adaptation on the Pareto principle, or the 80-20 rule, as many like to call it. I'd love to hear more about your adaptation and how you apply that approach to disrupting the status quo.
Oh, for sure. And you know what? I'll go ahead and read it just so that the listener can get a little bit of a
by all
teaser here.
means.
And I'll admit I had to water this down because I was probably being even more brazen when I first wrote it. I envision ripple of change following my version of the Pareto principle. If I draw blood from 20% of people by ripping the Band-Aid off, the other 80% can start to heal. And ironically, originally, I said something to the effect of, if I piss 20% of people off by the book. And I backed off a little bit from that. But I think the reality is not everybody's going to be happy with change. There is a certain subset of the American healthcare leadership, population, whatever, that's happy with how things are going. There is a lot of money moving around. There is a big percentage of our GDP. But I think the reality is the vast majority of individuals who are touched, worked in, associated with healthcare, which, if you think about it, is all of us, have some level of frustration. And so really the idea behind the principle is we've got to be willing to rattle some cages, upset some apple carts, use whatever cliche you want to have to that smaller percentage so that the majority can have a better experience. That's really what I was trying to say with that. Without a doubt, I have upset some individuals, either historically or perhaps even in the recent past, by my approach sometimes. But I think the reality is we need leaders that aren't afraid to upset the status quo a little bit, because it is not working. It is, I shouldn't say that. To a large degree, it's not working. There are so many wonderful, positive pockets of things going on, but the collective is certainly not happy with what's happening in the United States.
Thank you for sharing that. I would love to know what's on the horizon for you. What are your future plans for continuing impact in the healthcare system and addressing the issues you've highlighted in your book?
Oh, yeah, we could probably talk about this for a bit, and there's a few layers to this. So I think I'll maybe tier it. One of the things I'm doing is I work for an amazing physician-led organization called Emergency Care Specialists. And they are very forward-thinking and wanting to do things in terms of improving access and containing costs and just a lot of positive stuff, doing things the right way. So that's some of the work that I'm doing. And that's probably more trying to make change from within the system, the work that I do with them. The second layer to this really has to do with the work I do from an advocacy perspective with groups like Medicine Forward. I've got some connections with the Current National Network, Doctors for America, just to name a few, because I think the connectivity, and actually I should say this Healthcare Reinvention Collaborative, I think, is another amazing group out there that's working on building an impact network, because I think if we can connect and consolidate these voices, that'll be magical. Where that's all going to go, hard to say, because to a certain extent, we're building the aircraft while we're flying it, because we need new models of care delivery. And there has to be that capacity for risk tolerance and appreciating that there's going to be failures at times, and things aren't going to work 100%. And then the third component is really with, I suppose, my voice, whether it's through the Ripple of Change podcast. I've started working on a second book, albeit I don't know that it'll be at the pace with which I did the first book. But so there's several layers to the work that I'm wanting to do and to facilitate change. Where would it all land? I don't know. It's really interesting having authored a book, because it acts like a key that opens up doors and opens up conversations and allows for other change agents to get connected. So I suppose I'll leave it at stay tuned.
So I like to end the podcast with one final question. And that question is, what is one bit of knowledge that you'd like to impart on our listeners today?
Oh, just one, huh? I suppose I could. I think in the context of the flow of this discussion, I think the thing that I'd like to impart to the audience is your voice does matter. Your actions matter. And we can either continue to focus on the negativity and the frustration and sensationalize things and be polarizing and pointing fingers, or we can take the other side, offer hope, offer positivity, being kind, saying thank you. And I would make the case that if we had 300 million people doing something in that category, not only would healthcare be a better place, but so many other things would be a better place. So my challenge to the audience would be do something positive, and we can hopefully start to see things move in really a better direction.
Thank you so much, Dr. Otten, for sharing your time and your passion with us today. It has been a pleasure to have you on the podcast.
Oh, I truly appreciate it. And I'll hold the book up one more time just because I'm very proud of what we did. And if you're interested, check us out at ourquadrupleaim.com.
Thank you to all of our listeners for joining us on the podcast today. We appreciate your support. To hear from more healthcare voices like Dr. Otten, hit the subscribe button and share this podcast with your friends and family. I'm your host, Catherine Cummings, and you just listened to Healthcare Voices.